Assalamu alaikum. Today we are going to talk about the elbow stiffness, that is post-surgical. Now the patient had a history of intercondylar fracture, and the patient underwent surgery, open reduction internal fixation. After the open reduction internal fixation, the surgeon advised my patient to keep on wearing the shoulder sling, and he has been using it since then. It's almost 42 or 45 days now. The KYs from the wrist and other regions were inserted, and now the KYs from the wrist have been removed. If we talk about the problems right now, I will first request him to perform the active range of motion so that you can see what are the differences or what are the limitations in the range of motion, supination and pronation. Now you should see when he is doing the supination, he is trying to move his shoulder into external rotation. So keep on looking and look at the movement of the elbow. If we ask him to perform the same movement of supination, elbow flex karke kare. Yes, keep them flexed and now perform. Yes, opposite. Now you can see the difference in supination and pronation. Can you extend your fingers like this? That's good. Now try to perform the ulnar and radial deviation. If I can show you from here, now please perform the ulnar and radial deviation. If you can see over here, or if the camera is showing you right now, he is moving his fingers only, not the wrist. So see, it's just the movement of the fingers, but there is no movement at the wrist. So if we are going to perform this movement, this is radial deviation and this is ulnar deviation. Okay, so after that I would request you to please perform sit like this, facing that curtain, and these are the marks of the surgery. Over here you can see these are the marks of the surgery, and these are also scars from the surgery. Now please perform the full flexion, elbow flexion first. Yes, this is the maximum amount of flexion that is available actively. And now please go for extension, and this is the maximum amount of extension that is permissible right now. Now the problem is that because of the surgery, there is scar tissue that is preventing the elbow flexion. Similarly, the bicep, if you can see this region, the bicep has been shortened and it is not permitting the full elbow extension. Secondly, we are concerned with the nerves, the median and the ulnar nerve. So if you can please show your hands like this. It might be difficult for you, but there is a bit of difference between the thenar eminence and hypothenar eminence as compared to this side. This is the sound side, and the patient has also limited mobility of the median nerve and the ulnar nerve. So what can be the best plan of care for such conditions? Very simple. You can perform this passively first, and then of course you can encourage your patient to perform actively. Now this is called the handshake position, as if I am trying to shake the hand, and I am going to stabilize this from above the elbow, and I can perform maximum supination, and at the end I can stretch a bit, hold it for 5 to 10 seconds, or as long as up to 5 minutes. So it depends upon you and your patient's tolerance, and there can be a bit of stretch or even pain. Hold, and then let go. So you can perform about 20 to 25 repetitions of supination. When you are going to stress this, there can be pain over here and there can be pain over here also. Superior and inferior radioulnar joint can show the signs of pain, so that is something normal. For the pronation, we have to, again, in the handshake position, we can perform the pronation. You can see, or the alternate is you can place both your hands like this. Please keep it here, and you can move it like this if you want with both your hands. And again, you can apply a bit of pressure. You must keep looking at the face of the patient so as not to increase the pressure. Then coming to the wrist and elbow. First the wrist. we can perform the ulnar and radial deviation. When we are going to perform the radial deviation, into the radial deviation and a bit of stretch, and hold this similar to the previous stretch, and then the radial deviation, and similarly hold into that direction. Then we can also try the wrist extension. Now, because of the short wrist flexor muscles, when I'm going to perform the wrist extension, he might be feeling a lot of stretch over here. There can be pain over here and even in the fingers, because these muscles, they have a tendency to get shorter very easily. So you can perform it like this also. It's a bit of pressure, but with this you have to hold it for 30 seconds or 40 seconds or as long as the patient tolerates, with about 20 to 25 repetitions, and gradually you'll see that the muscles over here are going to be lengthened. Similarly, we can perform the wrist flexion. So these are the 4 movements: the flexion, extension, ulnar and radial deviation, that must be performed over here. The patient can use some sort of hand exerciser or a gripper to strengthen these muscles also. Now coming to the elbow, this is the elbow flexion maximum. I am holding with one hand above the elbow, and with the other hand I'll keep it straight, and I'll keep on pressing and hold it there, and after that you can let go. So similarly you can raise it, make it a bit stronger, and then you can keep on stretching it. For elbow extension, what I'm doing, I'm placing my hand behind the elbow and in front of the wrist, just proximal to wrist. Relax. We can anchor this with our body and we can press downward. Now this downward force, as you can see, there is a lot of stress onto the bicep muscles, as well as the patient can move his shoulder. So you have to advise them not to do so. Relax. And when I'm doing this, there is a lot of stress over here also, you can see. So just hold it there. You can also bring the elbow back into, or the shoulder back into extension, and hold it here and then let go. So the number of repetitions for flexion and for extension can be 20 to 25 or up to 30. The stretch time for flexion and extension should be about 25 seconds to 30 seconds, and the pressure should be maximum that is tolerable by the patient. There can be some pain, there can be some stretching, but without this there is no shortcut. And do remember that with these exercises, there are 2 exercises that are vital for your patients. One is that he should extend his elbow, abduct the shoulder. I'm not sure if you are able to see it, so let's see if you can see. Yeah, put it over here, and yes, and with this he should try to extend his fingers and wrist. So that can be done passively. This is good for the median nerve right now, because we want the median nerve to be mobilized also. And the last part is when we want to perform the exercise for the ulnar nerve. So this is the position, so like this, and from here it has to be done passively. Now you see the reaction of the patient, because it's just a bit of, I'm just touching. So see how the ulnar nerve is hypomobile. So you can perform it in this position first, and gradually you can raise this up all the way. So hold this for 5 to 10 seconds and then let go, for 5 to 10 seconds and then let go. So that will help your patients a lot. Along with this, you can also perform electric stimulation, and of course there is no parallel to an expert advice and opinion. First, make sure that your physiotherapist or your rehab professionals or your doctors are going to recommend these, and then you can perform this at home. If you have any questions and comments, do let me know. Thank you very much.